Fantastic. Good morning, everyone. Welcome to the second day of the conference, The Languages of COVID-19, Implications for Global Healthcare, generously funded by the British Academy and generously hosted and supported in all various ways by the Institute of Modern Languages Research at the School of Advanced Study, University of London. So far, we've had some great panels, great discussions, fantastic presentations. No major hiccups in terms of technological challenges. I have a piece of wood to touch at this point. So welcome to the second day. We are we're looking into some fascinating issues of translation and communication in a public health crisis with 3 presentations this morning, followed by language barriers and overcoming them at 11:30, then 2 more panels after lunch, and we'll conclude with a roundtable. I'll be mentioning that throughout the day, but I wanted to invite everyone at this stage already to the roundtable at 5:30. Let's make it like a semi-social event, if that's okay, and everybody bring a drink of their choice and then a snack, and let's just have what we would have had we been all together around the big table or in a big room where we could just simply chat and exchange our thoughts and impressions. So without further ado, I suppose, I'd like to open our first panel for this morning and introduce our speakers. From the University of Surrey, we're being joined by Demi Cristalidou and Sabina Braun. And I'll let them introduce their own topic. Over to you.
Yes, morning, everyone. I'm going to share my screen, if that's all right with you. Right, and quickly check whether you can see that.
Yes.
Yes, absolutely.
Yeah, that's it.
Brilliant, okay. Hi, I'm Demi Cristalidou, and together with Sabina Braun, are super excited to be here, and we will be sharing the findings of a scoping review that we performed over the couple of the past months, focusing on risk communication during COVID-19 and linguistically and culturally diverse communities. And we focus in particular on the role of translation, translators, and the role of technologies. So let me start by saying that we have divided today's talk into 4 main sections. We would start by saying what we wanted to investigate, how we conducted our research, so a few words about the methodology that we used, what we discovered, so the major findings that emerged from this scoping review, and we would like to share a few recommendations, if you like, on how we could possibly improve risk communication with regard to translation. So let me start by saying that the topic of the scoping review was risk communication, and by that we mean official communication from experts to the public in relation to the COVID-19 pandemic. And as I said, we focus on linguistically and culturally diverse communities globally. The objectives of the review were to review communication practices in these communities, and also to gain understanding of the implications arising from multilingual risk communication in order to discuss later what and how different approaches could possibly contribute to improving risk communication in linguistically and culturally diverse communities. So a few words about the methodology. If you're wondering, as I said at the beginning, this is a scoping review of the literature, so we relied on the widely cited guide for scoping reviews by Peters and colleagues. And the 3 research questions that we investigated are the following. What risk communication strategies were implemented globally in linguistically and culturally diverse communities? What was the role of human agents, technologies, as well as translation as a process, but also as an outcome in the implementation of risk communication strategies? We performed a search in various databases, Web of Science, ProQuest, PubMed, and Google Scholar. we consulted and screened papers starting from the beginning of the pandemic. So from December 2019, published in December 2019 until mid-May 2021, we conducted a search by relying on, by building an extensive, a thorough, if you like, search strategy by relying on key concepts, a process similar to systematic literature reviews when it comes to the development of a search strategy. So we looked for papers that talked about risk communication and then other ways, other synonyms referring to that, and COVID-19, and translation or interpreting, and language barriers, and ethnic minorities, and other synonyms used to refer to ethnic minorities or migrants or refugees. For practical reasons, we consulted only publications that were written in English in this review. And the inclusion criteria that we applied were quite strict. We wanted to include studies that reported on risk communication and had a reference to language-related issues or translation, and at the same time made reference to the availability of information, to the way it was being accessed during the pandemic, to the way it was accepted by the public, whether it was adapted or not, and whether there was any mention of technologies, either as translation platforms or means, if you like, but also as communication technologies in general. As you can see here, the search yielded more than 2,000 papers. We performed screening, title, abstract, and then full text. We applied the criteria I talked about earlier on, and then we ended up with 40 papers, including also some information from Grey literature. And we also performed a hand search. And as I said, in total, we analyzed 40 papers. The countries where the studies were conducted, or the studies where the authors of these papers refer to when it comes to communication practices, are the ones that we can see here. There was another review, very useful, by Maldonado and colleagues. They refer to communication strategies in Europe in general. In 25 of the 40 studies that we included, there was no country specified, and that means that the authors of that paper talked about risk communication in linguistically, culturally diverse communities in general. Let's have a look now at the research questions. The first research question was, what risk communication strategies were implemented in linguistically and culturally diverse communities? What we found out is that there was obviously top-down risk communication, so from authorities, from government to the public. However, there was evidence that this type of communication was not always available, was not always timely. Translations, when they were made available, they were not always updated, and the context, the local context of the public, of the communities, were not always taken into account. There were shortcomings in top-down risk communication, and this is exactly what triggered some bottom-up approaches. Starting from local context and people's needs, and trying to address those needs, linguistic and cultural needs, translations were performed of top-down mainstream messages, and there were also adaptations to local needs, which was very, very interesting. Most of the bottom-up approaches were initiated by NGOs, as we would guess. We had, for instance, Doctors of the World in the UK, and also the British Red Cross, who worked with translators and translated into 61 languages, which was quite impressive body of translations. We also noticed that bottom-up collaborative projects among universities were established. Translations of official information were performed either by students or by volunteer translators, or by translation scholars as well. This is an example that we find in the literature, the Viral Languages Project, a collaboration among universities, and they published their translations and messages through YouTube channels and Facebook. At the same time, interestingly, we noticed that there were also hybrid approaches that were recorded in the literature. So a combination of bottom-up and top-down. For instance, government officials assigned members of the public, such as community or spiritual leaders, or even radio producers, to translate or even adapt official information into different languages. Now, let me go back to the 4A framework that was adapted by O'Brien and colleagues, which we found particularly useful within the framework of this review, because we reviewed the available evidence through the lens of this framework, so through availability, accessibility, adaptability, and I'm forgetting one. Availability, acceptability. I'm sorry, we'll come back. I'm not going to waste any time on that. Sorry. But when it comes to availability, we noticed that there was a lack of information that was targeted and tailored to migrants' needs about access to healthcare, about COVID-19 and the vaccine. And in 23 of the 47 countries, information was available in the local language, but also in English and other commonly used languages. However, it was striking to see that only in 9 European countries, migrants and ethnic minorities had access to helpline in at least one of the 3 most common migrant languages in that country. And then Belgium was the only country in Europe that provided posters on mental health and well-being and COVID-19 with translated versions in 31 languages. We also noticed that there was no public health communication or disease prevention for specifically migrant groups and their health needs across 47 countries, according to a very useful review by Maldonado and colleagues. And last but not least, information in sign language was not always available, as we know, from the outset. With regard to accessibility, healthcare systems and official information were built for technology literate people, for people who were proficient in official languages of the country, and this was exactly what led to problems for people from ethnic minorities and other people with limited language proficiency. We also saw that the content of information and process of its dissemination did not always take the local context into account, as I said earlier on, and this made the information that was disseminated quite inaccessible for certain groups of people. And this was mainly due to temporal reasons. For instance, in Belgium, just to give one example, announcements of official risk communication by the national government often happened on a Friday night, which corresponded to the commencement of Shabbat. And at that time, Jewish community did not really have access to the social media or to TV, so this kind of information did not really penetrate the Jewish community in time. We also noticed that there was a discordance between communication channels that were used by the authorities and the community's own communication preferences. Again, TV, for instance, was a widely used medium, but not everybody had TV in certain communities. And then again, last but not least, linguistic unavailability. As I said earlier on, certain information was not made available in languages or in even in specific modes. Geographical proximity played also a key role in terms of accessibility. And just to give another example, it was particularly challenging to provide information, provide screening, and also provide healthcare to dispersed Bedouin communities in remote areas who do not have good access to healthcare. And then information was made available in formats that did not really meet the local community's needs. For instance, we see here an example from the NHS. Information was made available in Urdu, but in writing. So certain people who could not read Urdu were not able to access this piece of information. With regard to adaptability, alternative sources of information and lack of trust in authorities created confusion and mistrust among migrant communities. This was a widely spread theme, widely covered theme in the literature. In a bid to reinforce trust, in some cases, information that was sent out by the authorities was either endorsed by religious leaders and religious structures, or it was translated and disseminated through social media by respected and trusted members of that community. With regard to adaptability, I can only say that we did not really find much evidence. There were a couple of studies that implied that pieces of information were adapted for use in other formats, but there was never an explicit reference. Right, so moving to the second research question, what was the role of human agents in the implementation of risk communication strategies? When it comes to the bottom-up approaches, we saw that respected community figures played a key role here, either as producers and creators of information. For instance, in the UK, we had South Asian doctors video recording messages in South Asian languages and sharing them within their communities. And that was a practice that was found everywhere in many parts of the world. We also saw these figures acting as agents of dissemination, so sharing information within their local communities. Respected faith leaders, for instance, were debunking myths associated with vaccination hesitancy in certain groups. Bilingual individuals produced and shared messages through social media as well. So we had studies that reported on diaspora influencers who reinterpreted official health information with references to experience of other transnational communities. Chinese diaspora influencers, for instance, making information available for Chinese in China. Volunteer translators rendered official risk communication in local languages. And also, interestingly, we had hearing people who are part of the deaf community, but also deaf people who do translation work, who posted informative videos about COVID-19 in many parts of the world. The third research question was, what was the role of technologies in the implementation of risk communication strategies? And what we saw is that technologies were used as a means for the dissemination of risk communication and other COVID-19 related information. The use of social media was widely covered in the literature. We had people who used, we had GPs and other healthcare professionals who used group video consultations as a means to reinterpret official risk information, official risk communication to specific communities in local languages, which were followed up by consultations. We also had people who shared videos on YouTube and other channels. And also, interestingly, that was particularly the case in America. Mobile platforms were used to deliver text messages to patients on behalf of healthcare companies. Technologies were also used as a translation tool. Although it was not explicitly stated as such, machine translation seems to have played a key role here. People translated texts into patients' languages by relying on Google Translate, quite often, apparently. Technologies were used as a means to enable remote interpreting, as we know, and also technologies were used to as a means to organize crowdsourced translations. What we found interesting is the following. Technologies served also as a means that seemed to exacerbate existing inequalities. People lacking access and skills to use technologies or people who were unable to pay for broadband or mobile data were not always able to access information through technologies. Older people or people who were less likely and less willing to use technologies did not always have access to risk communication that was shared by means of technologies. Certain communities, we know, do not use technologies, and therefore they were not able to access COVID-related communication. And migrants and healthcare professionals in general perceived that language barriers increased further due to digitalization. Moving quickly to the fourth research question, what was the role of translation now in the implementation of risk communication strategies? We saw that translations of official top-down risk communication were produced in different formats, in writing, orally, but also in terms of sign language. When it comes to the written translations, most of them were performed by volunteer translators who were reportedly experiencing time constraints, often were faced with limited language proficiency, They were not always interculturally aware of certain issues, and at times they even lacked technical knowledge. With regard to the oral translation, there was no evidence of spoken language interpreting as a strategy to make risk communication available, but there is a reference to volunteer interpreters in hospitals and also reference to the difficulties arising from the use of protective equipment, making communication difficult, also in interpreting settings. And as I said, sign language interpreters were used as well. Another interesting point is that there seems to be a preference for monolingual information created at grassroots level. And this was particularly the case with community healthcare professionals producing monolingual, but at the same time, culturally adapted and community inclusive messages. And vloggers produced video messages explaining and commenting on official risk communication in monolingual settings. A few words before I conclude, a few recommendations, if you like, our reflections on the available evidence. And again, we focus only on translation process and outcome here. Perhaps commissioners could possibly invest in proactive structures, in quality and also prompt delivery of translation in various modalities in future healthcare crises. They may want to safeguard and promote transparency further. They may want to invest in co-produced solutions and integrate them into education programs as a resilience strategy for the future. They may want to pre-test health messages with a target community to identify language and retain whether the language retains the meaning of the core message and considers the cultural context for the target audience. Also measure comprehension with the end users, ensure adaptability of translations at a more micro level, develop evidence-based guidelines on inclusive risk communication by drawing on the 4A framework: availability, accessibility, adaptability, and acceptability, and then also assess overall the affordances and limitations of technologies. And a few words before I conclude. On professional translators and interpreters, we see them as active agents of change in the chain of trust. They do have a key role to play in future healthcare crises when it comes to risk communication. They can invest even more in proactive and collaborative work, develop fast-track courses for volunteer translators. They may want to team up with creators of monolingual texts and advise them on translation-related issues, but at the same time know when to step back, embed some feedback loops in the translation process, advocate also on a more macro level for the inclusion of social determinants of health in translations, and at the same time, practice translational humility and enhance intercultural competence. That's all from me for now. Thank you.
Thanks very much, Demi. A fascinating, very comprehensive review with very, very rich presentation. Thank you. You are also very disciplined in terms of your time management, which leaves me with 1 or 2 minutes for you still to use. Sabine, would you like to add something? Or would you like to?
Yes, thank you very much. So yeah, I will say, I mean, the details of this work are really to Demi's credit. So we've sort of conceived the study together, but I don't think I should take too much credit here. I would like to point out one thing. Those of us who know a bit of our work, the work that myself and others in Surrey have done on technologies as a sort of potential facilitator, but also seeing the difficulties of it for a long time. I think what we are seeing now really emerging from this review as a picture is how much we need a comprehensive approach and how much we need a comprehensive solution. So that's also a plea from us, I think, to say technologies are not the solution. That's very clear what's coming out here. Technologies have many different roles to play to facilitate, for example, the delivery of interpreting, to be used as a tool. So all the things that Demi has lined out. but they need to be part of a much broader and comprehensive solution. That's one point. And the other point I want to add is the other notion that we, I think, see implicitly emerging here is not only in our work, but across much of translation work is, again, and in new forms, is this whole notion of trust combined with literacy. So that some of the people who need to use the very different kinds of approaches or solutions, be it technology, be it volunteer approaches, do they have the right kind of literacy and do they trust those approaches? So maybe this is also something we can sort of spin further throughout the day. So these are my mini additions to this. Thank you.
Fantastic. Thanks very much. I can see that we already have started receiving some questions in the chat box. So let me suggest that we'll have a joint discussion after all three papers this morning, which leads me to the next speaker on our list today, my wonderful colleague Suwan Harding from Queen's University Belfast, I'll let Suwan introduce her own topic.
Okay, good morning, everybody, and thanks for joining us. I'm wondering if there's any Americans here because it's probably the middle of the night. Okay, so I'm going to share my screen. Tell me when it works. Good?
Yes, it does.
Perfect.
Yeah.
Okay, fantastic. So my talk is going to follow on quite well from Demi and Sabina's. Stay on country, care for family. When I first heard about, when the COVID pandemic first began, I have a friend who lives in a remote Aboriginal community in Western Australia. And as we were talking, I was like, but you're not going to be worried about it because you are miles from anywhere. And it seemed kind of logical to me that the isolation of these communities and parts of Australia would mean that COVID would be something that would completely pass them by, that it belongs to kind of the rest of the world. But I was really naive about that. My friend said, oh, absolutely not. We are taking it very seriously and we're closing roads and closing schools and borders and all of those things. And that to me was very intriguing that people would respond in that way and take it seriously in that way. And so then when the call for papers came through for this project, I thought, well, this is a good opportunity to investigate how these particular communities responded to the threat of the pandemic. So I could look at the whole of kind of northern and remote Australia, but I decided to just focus on the Northern Territory. And just to give you an idea of the kind of place that we're talking about, it's diverse and it's remote. So Northern Territory is in that middle centre bit of Australia, and from north to south is about the distance between Rome and the Danish border with Germany, and from west to east is from about Paris to Zagreb. So we're kind of looking at quite a big place with a very low population. And interestingly, the population of Northern Territory is less than half of the population of Tasmania, right down the bottom, which is Australia's smallest state. About a quarter of these people here are Aboriginal and Torres Strait Islander, and these are the people that my study is interested in. So it's remote, huge distances, sparsely populated, but it's also very diverse in terms of its geography and therefore its culture, from the dry deserts up to the tropics and the islands up in the north. So I just wanted to give you an idea about the kind of place that we're talking about. So my friend in Beagle Bay was right, because the vulnerability of Indigenous remote communities is extreme. So these are some of the comments. I just can't see my, okay. These are some of the comments from recent publications about the vulnerability of Aboriginal people, and they stem from existing conditions, which basically, in a nutshell, come from 200 years of the violence of colonisation. And so there is evidence and the consequences of this vulnerability across in health and economics and education and all of these sorts of things. You can see it there in the quote from a recent publication here. What I found also is that I didn't know about is that in 2009, the swine flu was actually quite damaging to Indigenous populations in Australia. And this quote here from a paper at the time talks about the rates of notification, hospital admission, and ICU admission were 3.5 times, 12 times, and 5 times higher, respectively, than the non-Indigenous population. So what we have here is an experience. People knew, unlike me, people knew that COVID had a potentially a devastating effect on these people, and also that they had an experience of that devastating effect already back in 2009. So there was quite a rapid response to this. In early March 2020, the Aboriginal and Torres Strait Islander Advisory Group on COVID-19 was formed. That's a task force. It's at the federal national level, but it has representatives from all the different states and territories and Indigenous organisations as well. In Northern Territory, public health emergency was declared on the 19th of March. There were border closures, mandatory quarantine, travel and gathering restrictions. Indigenous people can be quite mobile, so there were restrictions on internal mobility and gathering. And then there was this public health campaign, and it was about keeping your mob safe. Your mob is your family, your people. And the three basic messages of this health campaign were staying healthy and strong with good hygiene, protecting your communities and elders, and staying connected. This task force actually still meets, and they meet twice weekly, and every 2 weeks or even more, and they put out reports of their work, and they've kind of been really fundamental. So we'll come back to them at the end. But this was the message that was coming out of this particular group from federal government, I suppose. And then the question is, how do we translate this health campaign about keeping your mob safe to the people who live in this diverse and remote place? Because not only is it geographically and culturally diverse, it's linguistically diverse. So in the Northern Territory, there's more than 100 Aboriginal languages and dialects. You can see there a list of some of the most widely spoken. And many of these, I would say probably almost all of them, are endangered or vulnerable in some way. So the figures in the middle of the screen just show you how many Aboriginal languages across Australia have been lost since colonisation, and that the ones that remain are considered to be endangered. So we're talking about a linguistically diverse and linguistically vulnerable population within the diversity and the remoteness of the Northern Territory. So I then wanted to look at how this message was translated into this situation and into this linguistically diverse place. And so what I want to do now is basically just give you a lot of examples, because I knew nothing about this. This is not my field, and I was really curious as to what was happening. So I just want to share with you some of the examples that I found. So one of the key things is the use of plain English. And on the Northern Territory Government's Aboriginal Interpreter Service website, this is an example of the instructions, if you like, about how to use plain English. And this plain English is what is evident everywhere in all of the messaging. And you can see it here in this example. COVID-19 is a serious illness that can make you very sick and may cause death. And together with plain English is the use of pictograms and kind of infographics and visual messaging as well. There's a lot more about plain English on the website, but these were just some examples of what to do writing in plain English. The other thing is combining plain English with localized information. And I really struggled with this kind of term, localized, and I guess it's the kind of cultural translation that Bay was talking about yesterday. So you'll have the plain English. Make sure if you feel sick, you call the clinic. Remember, coronavirus is really cheeky and it can hide for a while. So you have this plain English and you have the pictograms, but the whole idea about going to town is what people do. So it's not just about personal and social hygiene, but acknowledging how people live and then providing the relevant information for what it is that they do and for their lifestyles. This is an example of localized and visual. In fact, it was non-verbal. There was no spoken dialogue for this series of 6 videos that the Northern Territory government put out. But what they had is a series of videos about not sharing food, not sharing smokes, not shaking hands, not kissing and hugging and all of those things. And they had these little scenarios filmed on remote communities. And they also visualized this idea of where the COVID was. You know, it's on your hand and it's on the bottle and things like that. And using this very kind of simple visual information to convey a lot of the information. Yeah, coughing into your elbow, physical distancing, cleaning, etc. So this is an example of that kind of, again, that cultural communication that we were talking about before. So plain English, visual and localized. But of course, with all of these 100 languages, there was lots of translation, messages in language. And so the posters and the flyers that were coming from federal government were translated into several different languages. And this is an example that you can see. They basically, there's no change in the pictograms, but only into the different languages. And a big way that the message was translated into language was through audio clips for radio broadcast. So the government, there were these different campaigns, if you like, and they'd just be really small clips, like a minute and a half or something. And we can see here that they were translated into different languages, 17, 13, 19, 18. And so on the website, there'll be all these MP3, and then you can either click on it, listen to it, or local radio can pick it up and broadcast it as well. They're continuing to do that. I've noticed over the last year of looking at this, that now with the vaccine rollout, they're continuing to translate and make information available about the vaccine. And this is the sample transcript of one of those little clips. And you can see here that we still have this plain English. People who live in Northern Territory communities should still do normal things. It's okay to eat traditional bush animals and plants. Stay clean, wash your hands. So the plain English is here, and the cultural communication, if you like, is also here. I've got West Creole examples. I was going to put a few examples because when you listen to the West Creole audio, you can hear, because Creole is kind of partly understandable to English speakers, you can hear how it's kind of culturally adapted. So it looks very official here. It's okay to eat traditional bush animals and plants. But when you listen to the clip, they talk about bush tucker, or they say you can still do a lot of things. And so this kind of cultural adapted message for the listener, so that it doesn't sound kind of formal in this way, really comes across in the audio. So the government wasn't the only body, I suppose, that was putting out on different messages. There are 4 land councils in Northern Territory, and they are elected Aboriginal councils, and they also played a role. So something that they would do is put out these social media videos, and they would have elders speaking and giving the message, or they would have you can see this coronavirus video on the right-hand side, would be the same video, but then it would be translated into different languages. And the subtitles are the same kind of plain English, if you like, below. This is an example here, the executive member from Central Land Council. His message, he'll say, this is not only a white fella sickness, but ours too, a real threat to all of us, Anangu, everyone. So this is the little clip, the description of the clip that he's giving. So he tells it as it is in Pitjantjatjara, and I can't move to other places, travel around, but should return to my camp, and that is what we have got to understand. So this is this idea that we're kind of getting elders and respected people from the community also contributing to the message. And they will, again, they'll be very direct and relevant. This is what you have to do. And again, relevant to people's lifestyles and what it is that they do. They also code switch a lot when they speak. So they will speak in English and then kind of, it'll almost be bilingual. They'll kind of translate themselves or just repeat the message in the different languages. So this is another example of a Facebook video where the elder is talking and telling people, you sit down in one place, don't move around, lock down. That means lock down. I know how he said it because I've listened to it so many times. That means sit down. Don't go to uncle's place and in town and fool around and talk to people close up. You need to give them room. So this is how he's speaking. What you don't see in my transcript here is where he switches into language and adds that as well. But I want to just draw your attention to the bottom of it where he says, we got to look after each other. We got to look after each other. We got to care for each other and make sure our kids know what's going on. So a lot of the messaging that's coming through here is very communal and collective and about caring for each other. So stay on country and care for family is the title. And we talked yesterday about some of the war metaphors and that overly positive messaging that came from some parts of the world, but this is completely absent here. There's none of that kind of fear mongering here. It's really just about what it is that you can do. So this is an example from one of the land councils. This is another land council, Anindiliaqua, which is way up north in the Carpentaria. There's islands up there in the Gulf of Carpentaria. And this is an amazing example, I think, because it's a very small part of the world. There's less than 1,500 speakers of Anindiliaqua. And yet they were incredibly proactive in terms of creating resources for their people. They created a whole website where they collated resources. You can see here a video where they explain that you can't go into the health clinic this way, you have to go in another way, and it was in language. And a really nice example I like here is Buddha and the Beard. It was a radio program in the local program at the local radio where they talked about coronavirus, and they would have this anthropologist who's lived there for decades and a local elder, and they would talk about coronavirus in a very laid back way, something like in English and language and code switching. And this is a real example of just kind of getting the message out there in a relevant way to the people that are listening. Another example comes from, this is the Aboriginal, I can't remember, Aboriginal Resource Development Services. They also run local radio up in Arnhem Land and produced these videos, as we can see here, and lots of audio clips that could be used on the radio. And you can see that they've got these programs have been made to help Yalunga and the organisations working with Yalunga to learn about coronavirus. And we hope they help Yalunga make sense of the complex and confusing stories about coronavirus. So the same thing about getting information across clearly to people. Another example were the creative messages, and this was a video that was put together by a local group, actually a really good group, an award-winning group, and a kind of a famous singer in the area. And it was kind of a funky dance tune, and you had all the kids doing it, and it was a little bit comic. You know, they kind of accidentally shake hands and then have to run off and wash their hands, and they're all dancing. And if you look here, 1.3 thousand likes, if you like, and views. So this is an example where kind of the message is taken up by people within the community and disseminated, and that's actually where people really kind of hear it, and it goes viral, if you like, and people are really exposed to it. Skinny Fish Music is a Darwin record label. And more messages in language. This comes from the Menzies School of Health Research. These, same thing, they would be examples of an elder speaking about various information about COVID, and it would be translated into the different languages. And then there was also this series of short videos where Dr. Davies would speak with the local elders, and it would be like a question and answer situation where the women would talk to the doctor and they would speak, and again, code switching between English and language. It's really clear that the messenger matters. So who you get to give the message, it's coming across more and more that there was very deliberate ways to get community figures. This is exactly what you're talking about, Demi, involved in the messaging. So this is a video that was made by various groups. AMSANT is the Aboriginal Medical Services Alliances of the Northern Territory. And they each of these people in the clip was kind of giving another little piece of information. You've got to sit down, you've got to lock down, you've got to stay put, you've got to do what's right, you've got to wash your hands, this kind of thing. But you can see they're like elders, but also Olympian and in media, musicians, actors, football players. So this kind of real pride thing, I suppose, a kind of a national pride. These are Indigenous people who are well respected in the community, and they were then recruited to give the message. So the messenger matters, who it's coming from is also very important. And as the vaccination rolls out, this same kind of thing is continuing. So there's you'll find these videos of people getting the vaccine, and as an example, and to show that it's absolutely fine. And Aboriginal politicians, again, kind of stepping forward and being examples that they've had the vaccine. So my question was, how are the messages translated? And just in summary, the use of plain English, the use of visual information, pictograms, diagrams, and videos, localized, relevant, and colloquial, or this is the cultural communication that we were talking about yesterday. But of course, linguistically diverse. So they were and continue to be translations into language, posters, but also audio and video. These translations into language and adoption of the message by land councils, local organisations, creative groups, and Aboriginal medical organisations meant that this kind of top-down approach, if you like, was picked up. And this was organised, like the Aboriginal task force that I talked about at the beginning were key to this. So it wasn't that there was a lack and then people kind of took up the slack. It was quite a coordinated campaign. And the messengers matter. So Aboriginal elders, leaders, public figures, these are spokespeople and also examples. And I found that the message was and is actually consistent. It's the same. It doesn't keep changing across time. It's inclusive, meaning it's about us together. We can do this together. We will look after each other. We will look after our elders and our community and our country. And it's proactive. It's about what you can do rather than being afraid and having your freedom or anything taken away. Was it effective? These are the figures for Northern Territory as of this morning. There are 2 cases at the moment. They've had about 177 overall, and nobody has died. There have been 0 deaths in Northern Territory, and any cases that there are usually from abroad or people coming in, and so there's 800 people undertaking quarantine. So it's not the message alone, it's all of these other measures as well. But this was the message, and they did a good job. And these, so the June Oscar is the Aboriginal and Torres Strait Islander Social Justice Commissioner, and she talks about how well the message got through. They did an incredible job. It got through in multiple locations and different community languages. And in fact, she was saying that this should be the gold star standard for public health messaging. And it shows our Aboriginal and Torres Strait Islander resilience and adaptability, that the organisations are effective and that they should be proud. And I didn't expect this. So I'm really kind of amazed to see this. And yesterday we were talking about the model. What's the model for successful public messaging and translation that we're looking for? And I think there is a model here. It's been picked up by the international press. The Washington Post is talking about it and saying that there was an excellent response here from Aboriginal communities. It's probably the best evidence we have that if you put Aboriginal people in charge, then you get better outcomes. Of course, there's limits to my study. It would be very interesting to actually look at the people and the processes involved in the translation, who did what, when, and how they kind of culturally kind of adapted and all of those things. But, you know, from going from a point of naivety and ignorance, where I thought this doesn't matter to them, it doesn't really affect them, the contrary is true. And unlike most of the conditions and the federal, I suppose, relations with Aboriginal people, which has just got a terrible history, and it continues to be really marred by errors, I'm really amazed and surprised to kind of find this model of good practice. And that's why I wanted to share it with you today. And that's it.
Fantastic, Suwan. Thanks so much. Well, first of all, it's very reassuring that the Australian jabs don't hurt, as one of the leaders was very kind to point out. I'm still rubbing my shoulder from my second jab on Sunday. Yeah, it's humbling. It's terribly humbling, right? To just look at what you presented and have this sense of really human dimension. It's not organizations, institutions speaking, it's people, it's us, right? Yeah, and many questions here, I'm sure. Fantastic presentation, thank you.
Thanks.
Right, let's move on. In anticipation of the discussion towards the end of the session, let's move on to Rosario Martin Ruano from the University of Salamanca with her presentation.
Thank you very much. Can you hear me?
Yes, we can.
Okay.
Please see your screen as well.
Share my screen. Can you see it as well?
Yes, if you could just move to the full screen mode. Yeah, fantastic. Yeah.
Okay, thank you. Well, good morning, everyone. I thank the organizers for this inspiring and fantastic event. It's a real honor to be part of this. In my presentation, I will try to offer some insights, additional insights for understanding COVID through translation, and I will try to contribute to disentangling some of the challenges for intelligibility of and amid a global pandemic. This will be the thread that I will follow. I will first consider the ubiquity of translation, to approach the pandemic as a translated phenomenon, and from some glimpses of this pandemic, of the translational pandemic, I will reflect on the challenges and requirements for effective and inclusive translation practices. First, as for the point of departure, my starting assumption is that translation, an activity whose scope and implications by far exceed the traditional definition of linguistic conversion, is, as authors such as Lamberg, Gensler, or Budzinski have argued for, is a central and ubiquitous element in social life in the global era. Indeed, globalization has been defined as a result of constant translational processes, although it tends to be invisible and to often go unnoticed. Translation is continuously embedded in the communicative practices of our present, from series to information on newspapers or news feeds, or when buying goods in a supermarket. Individuals of interconnected and hyper-connected societies are constantly exposed to information and cultural products that are generated within processes of which include translation and which are never neutral. Certainly, translation in our era challenges our conceptualizations of translation. Translation today needs to be approached and seen not only as an activity producing or conveying a so-called translated text, transferring other clearly identifiable previous source messages in their entirety, but as errancy and hybridity as a phenomenon incorporated very frequently in the guise of fragments in what is perceived as seemingly original discourses and cultural goods, which becomes clearer in the case of international news. Additionally, in our multilingual and multicultural and increasingly ethno-diverse societies, radically transformed by voluntary or forced mobility and migration, translation is an all-pervading factor in many changes among citizens from various origins and between citizens and institutions. Although these translation flows do not usually take place on an equal footing, in many cases there are sheer asymmetries and even relations of subordination and deep imbalances between the poles producing discourse and knowledge and the receivers of those discourses and knowledge, including individuals and groups often obliged to rely on translation and to translate themselves, and also those excluded by incommunication, mistranslation, and non-translation. For this reason, both contemporary translation studies and other disciplines have experienced a translation turn and have highlighted the potential of translation to be used as an exceptional lens for analyzing our present and understanding and ultimately improving the dynamics of the world in which we live. So translation is an index of commitment to institutionally promoted ideas and values such as cross-cultural dialogue and inclusion and social cohesion, recognition and celebration of differences, and because of its capacity to embrace both other and self, is also a model for the future. In that regard, translation emerges as a magnifying glass to detect asymmetries, causes of miscommunication and inequalities, but it can also be a lever for change. Yesterday, and a word that was used was that translation can aim towards reimagining, words that Basnet and Johnston use in an article on the outward turn. This theoretical basis offers some insights into COVID-19, because a global pandemic can also be approached from the point of view of translation, which can be conceptualized and being a pandemic can be conceptualized as being an assembly or being embedded within a cycle of multiple and more or less successful translational processes, including non- and mistranslation. We have simultaneously hindered and enabled the understanding of the nature and risks of disease, as well as the potential responses to ease in different parts of the world and also among different social groups. First of all, it can be argued that a pandemic itself is not a reality, but a translation, an interpretation of a health emergency situation, and a process of naming and designation. The abundance of enunciative performative verbs in the press release in which the World Health Organization declares COVID to be a pandemic, including verbs like characterized, describing, description as a pandemic, etc., can be taken as an indicator of the essentially construed and necessarily interpretive nature of what we take today as an indisputable and painful truth. COVID-19 is born as a pandemic in what can be defined as an instance of authenticated translation, an authoritative equivalence by an official institution, equating certain facts and figures with a medical term, an abstract definition awaiting to be matched to real context. Theoham's reflections on the nature of equivalence in institutional context is revealing in this regard. For Hermans, equivalence can never presuppose sameness, but is to be understood as a proclamation of identicalness, one which always negotiates, postpones, overrides, or overcomes in a certain way differences. In this regard, it needs to be taken into account that equivalence is always the result and conditioned by a certain context, one which is also molded by previous translational processes. Research on translation studies has proved, these are in turn affected by cross-cultural relations and dynamics, by pre-existing images of other cultures and cultures, by internalized bias and prevailing stereotypes. In this regard, in our case, at global level, failures in cross-cultural communications between the East and the West have been said to have slowed down the response of Western societies to the spread of the disease. Aleb Belk, for instance, suggested, and I quote, "We failed to react on alerts from China and Italy early in the pandemic." Research on news coverage of the outbreak suggests that data from those countries were initially presented and approached as a national foreign phenomena and not as circumstances affecting a global us. Research on news translations points in the direction that this can be seen as the result of translation. For instance, Baldion defines translation as a first-level gatekeeping mechanism in news production, influencing the very decisions of what material is to be disseminated, decisions which are themselves conditioned by ideological factors and that may want to promote ideological affinity, which influences the choice of certain material and the adoption of promotion of certain approaches or frames. In this regard, research on the news coverage in the months prior to the COVID being declared a pandemic, as Hafner suggests, has made clear that early coverage in the West focused mainly on the origins of the pandemic as well as the consequences, social, mainly economic, of the potential spread of the virus. And these frames were privileged over other ones, for instance, and what Hafner, information regarding the health risks and expert community response. Timosky's definition of translation as metonymy, in conjunction with warning, for instance, by Basnet and Lefebvre, that translation is never neutral nor innocent, are revealing because they help to understand that the importance of warning to tracking the exact epicenter of the outbreak and even to finding the serial patients supposed to have started spreading the virus in different locations might have eclipsed and overshadowed other important discourses, among them preventive discourse encouraging at early stages the use of face masks, avoidance of social contacts and crowds, or specific advice on how to act based on the experience accumulated in places which had been earlier hit by the consequences of the disease. Moving to another scenario, the absence of adequate language policies within our increasingly diverse societies was reported and has been found as a factor that has had a negative impact on the control of COVID in general and on the unequal fate faced by members of vulnerable groups due to communication barriers in particular. For example, in many countries, deaf communities denounced the lack of accessibility of messages of crucial importance, and members of ethnic groups, often in turn speakers of minority languages, have faced greater exposure to COVID and have contracted and died from the coronavirus at higher rates, and even are now having lower percentages as beneficiaries of vaccinations campaigns. This is, of course, due to many factors, including structural risk factors, but also sometimes it has to do with language barriers, including serial difficulties or greater difficulty communication problems, lack of access to translation, and exposure to faulty translation in different settings, including health settings. In this regard, for instance, Ortega has identified 3 main areas of improvement to prevent health inequities derived from linguistic barriers in the future, and I quote, patient and clinician language data collection in health systems, linguistically and culturally appropriate public health messaging, and healthcare workforce communication skills education. Along with these areas of improvement, the COVID situation has brought to light many extremely useful of successful instances of translation. Many translation and intercultural mediation initiatives have been undertaken, and we have had many examples of these today by different institutions, groups, and individuals during this global public health crisis. And these include translation into minority languages of information materials related to COVID, compilation of glossaries, professional and amateur subtitling of messages and speeches, use of face and remote interpretation by institutions, NGOs, private sector, language brokering in health settings, translation and information of scientific findings into a variety of languages, but also, as we also saw yesterday, translation and cross-cultural adaptation of songs, humor pieces, memes, messages of social networks, etc., etc. These responses, which can be seen as translation, although they defy the boundaries of conventional definition of translation, were context-specific, highly engaged, proactive, quick and accessible, effective and affective, born out of empathy and solidarity. They help to communicate across languages and cultures, and for this they also crossed and crisscrossed boundaries, semiotic codes, alphabetization levels, and all sorts of assumed orders. These practices, which with a broad mind can be defined as translation, in my opinion, are highly revealing for the challenges that translation as a profession faces today, and may shed light in some of the pending challenges. In this regard, from a methodological point of view, I think there are some really examples of what proponents of the outward turn in translation studies are arguing for. The basic idea of this outward turn is to use definitions of translation outside the discipline and broad approaches to translation to help to think of professional or established definition of translations, which might be fossilized into traditional or even out-of-date basis, not in tune with the transnational and fluid character of our contemporary reality. My argument will be that these external definitions of translations may help to revamp ideas and practices of translation in its more common meaning as a transfer of text, such as those that have been applied by professional translators in professional settings during the COVID health crisis. Focusing on two different professional fields, I will try to show that when invoked and applied in this narrower mirror, translation has often acted under the influence of restrictive ideas about communication and restrictive language and translation ideologies. If we go to the institutional realm, for instance, many praiseworthy initiatives have been put in place, but the outward glimpse we have taken may offer us a broader mind with which to ask additional questions which may enhance the objective that is sought with these initiatives. For instance, which languages are selected as target languages and which are not? Which are the criteria behind the selection of those languages? Additionally, what we might ask, these translations do exist, but how are they made available? How does one get to them? Any translation which is found at the end of a monolingual, thus inaccessible labyrinth is perhaps an additional example of what Kaisa Koskinen has termed existential equivalence, translation which do not strictly comply with an informative mission, but whose main merit is to exist. And finally, arriving at the translated text itself, one might also wonder, what if the year of translation actually expired? What translation ideology or which translation regime underlies it as a product? Institutional translation often complies with what Laura Sonotti has named an ethics of sameness, resulting, to use Koskinen words, in surface level similarity. And whereas this model of translation by default is normative and thus the one admitted in the professional one institutional domain, in terms of effectiveness, is it the better? In a world of different languages and different language patterns, does similarity with the original text result in instant intelligibility? Is the selection and arrangement of information, the textual patterns used, even the visual elements, aid in getting the message across quickly, clearly, in a plain and even friendly manner? Or does this translation model and ideology poses additional hurdles to comprehensibility? This is a question we might also want to ask ourselves as professional translators, but one that perhaps we might want to pose in professional fields where translation and perhaps non-professional translation is often called upon. To illustrate this point very briefly, I will share with you some of the findings of a research I carried out in the field of news translation, and which has been recently published, where I analyzed the 3-month corpus of news dealing with COVID-related research and published in what can be called a hyperlocal digital news outlet. And this study allowed to perceive that most of the articles studied on COVID research reported on international publications by research groups based in foreign countries, which shows obviously an alignment with the interest of transnational agenda with a global us. But more than that, the study showed another trend which actually contradicts which has been taken as a norm in news translation. For producing translations that read as original texts in the target language, these articles showed great signs to be the result of machine translation, scholarly or not post-edited at all. In this study, I concentrated on readers' responses on comments, where we could see the effects of this type of translation that is increasingly present in our news discourse. In one case, the failure to comply with the textual fit expected of, for instance, scientific discourse, caused reactions of surprise or distrust in relation to science among readers. So what this takes me to is that what these examples show that in fact we can take a broad definition of translation, as we've seen during the COVID translation, to start reimagining our professional translational practices. In a very revealing statement, Michael Cornell has highlighted that translation is never a benign process per se, and it's misleading to present it as such. In this presentation, I've tried to highlight that in this super diverse society for the global era, translation is in any case ubiquitous, inescapable, an inseparable companion in pluricultural and plurilingual realities, even if it is because it's missed at some moment when it was expected to be explicitly there and it isn't, or it is appearing not in the form it was supposed to be. The outward trip to instances of translation in this translational phenomenon that we can conceive the pandemic to be enables us to see many modes of translations that have been and are going on. It also enables to see that translation can perhaps be thought of and practiced beyond its standard definition or conceptualization in particular professional fields. That translation may stretch its boundaries to contribute to a more plural and more inclusive communication and perhaps a more friendly and intersemiotically appealing conversations. In particular, and to sum up, at the macro level, we may want to consider translation and translation-mediated communication policies engaged with diversity. Some willing to listen to, learn, and unlearn from the foreign. So translation practices willing to use translation to open one's horizon and not simply to reinforce one's ideas, values, and beliefs. At the micro level, we might want to call for inclusive content management strategies achieved with creative ways of processing information, which may not be restricted to the verbal or to restrictive ideas or ideologies of equivalences that are normative in some professional domains, but which explore the possibilities of translation understood as an intersemiotic, multimodal practice that is now to play a role in a paradigm of inclusion. And the theories presented here, we have to remind that we are all translators, translation being a very plural and polysemous word. As professional translators, we can certainly explore that polysemy too. In the current COVID situation, it might be wise and health-wise, and for the future of increasingly plural societies, it can be either a moral duty or simply a matter of keeping pace with times and need to evolve, because translation is a word that also needs to be continuously translated. I thank you very much for your attention and will be happy to receive your comments or questions. Thank you.
Thanks very much, Rosario. Fantastic. Yes, I love the notion of translational engagement, and I felt that it resonated with much of our discussion yesterday as well. That translation is a relationship, not just transmission or transfer of texts or messages, but the process of sort of making it your own and maybe responding to it. Right, yes, I think a big round of applause is due to all of our presenters this morning. What a start of the day. And I'm pleased to open the discussion. I think we can maybe go until 11:05, if that's okay. we'll see how it goes. We already have a couple of questions in the chat box, so we can start there. But in the meantime, feel at any time invited to just pop your camera on and ask your question verbally or sign it or put it in the box. So may I start with the questions from the chat box? They were originally addressed to Demi and Sabine with a couple of thanks for sharing results of your study. There's a question about one of your 4 criteria, the one related to acceptance by the public. How is acceptance by the public defined and how was it measured in your study?
Yes, thank you, Piotr. I think that this comes from Claudia, if I'm not mistaken, and that's an excellent question indeed, because it allows me to clarify that. Hi, Claudia. It gives me the opportunity to clarify that the purpose of the scoping review was not to do quality appraisal of the evidence as such. This is something that will be done, can be done, and should be done in the future. So what we did is, with regard to acceptability, as you said, we simply took over what was reported in the literature, and the way acceptability was covered in the literature was with reference to the way in which people applied that information, and whether they complied with public health messages as instructed by the authorities. So that was the way in which acceptability was portrayed in the literature. And I hope that this answers your question.
Thanks very much. And a related question to your study was also about diverse communities. What kind of diverse communities were involved in your study or included in your study?
Mm-hmm. Yes, indeed. Diverse communities, what we mean by that is communities and groups of people who are diverse in terms of linguistic and cultural background. As I said, we reviewed evidence that reported on different parts of the world, and there were way too many diverse communities to name all of them now, but I can briefly say that we included Indigenous communities, we included Latinx communities, we included Bedouin communities, Jewish communities. Most of the times there was an overlap between linguistic and cultural background and faith, religion, and the distinction was not always clear. But again, as I said in the previous answer, the purpose of the scoping review was not really to assess the evidence, but to simply map the existing evidence the way it has been portrayed so far in the literature.
Yes, can I perhaps also add to that? Absolutely. So we were not assessing this, but we were, of course, starting from the linguistic angle, because that's also where we come from, the linguistic cultural. Excuse me. But what we see actually is how much this is interconnected to many types of other diversity. And again, it's clear from this that you can't actually so much disentangle this. So where there is linguistic diversity, there is cultural, and then there is other diversities. That's, I think, also pretty obvious. The other point is that in connection, of course, with COVID and with recovery, we see in many documents from the UN has this recovery plan for research. Also, we see how different types of diversity are pointed to, and I would also be very interested to see how roughly the work that we are doing here, not just Demi and myself, but in sort of everyone in this conference here, which has a strong linguistic diversity angle, cultural diversity angle, how much commonality there is with the response to COVID with other types of diversity that is being studied by different research communities. I don't have the answer immediately how we make this big connection to the others, but I think it would be very worthwhile doing that. So there is a kind of a coordinated response emerging, because I think we are largely talking about different types of marginalized communities. And I mean, we have also seen how those marginalized communities have in principle been losing out to COVID, and so this needs to be more joined up, I think.
Thank you very much. There's a question if your scoping review has been published yet.
No, it has not been published. We just finished. We just completed the review, but we do
Right.
intend to publish it, yes.
Well, we hope for your book.
Yes, oh yes, keep us posted. Oh yeah, of course. Right, I'm scrolling down through the chat box, but all of our panelists this morning, please feel invited to just, tune in and answer a question that you feel directed to you.
I want to make another comment because there doesn't seem to be an immediate question. The comment goes to Suwan. Excuse me. The comment goes to Suwan. Well, I think you had speaking of publications, I think you already have the perfect title for your publication about the messenger. But I was really intrigued to see the many connections that there were between your study and ours. And I think in your study, you were able also to show some really good examples of how this can actually work if all the ingredients are right. And the other thing I found fascinating was that that it also shows the sort of the different dimensions here. Yes, the importance of the messenger, then the important role of different kinds of technologies, like we also found, so the human agency together with the technology used in different ways. And then, of course, other dimensions, how these are coming together. I found that really interesting.
Right, do we have any other comments or responses?
Put my hand up.
Yeah, go ahead, Anthony. Good morning, good night to you.
Okay. Thanks very much to all the speakers. This has been a really great session. For Rosario, there's a tendency, I think, among translation scholars to think translation will save the world. And if it isn't doing it, we'll keep redefining translation until it damn well does. But perhaps like Suwan, I've been looking at other things. I've been looking at indigenous linguistics and at relations between Australian Aboriginal languages, which are very complex, and how they solve this. And in all the linguists' accounts, they don't talk about translation. So I thought they were repressing it, that it's invisible, etc. Now I've come to think that they had something better than translation. I mean, in pre-invasion indigenous relations between languages, they had no lingua franca. There is no Aboriginal language in Australia. They use code switching a lot. They have polyglot speakers using code switching and using re-narration practices that don't fit in with our Western concepts or post-Renaissance concepts of translation. And this came up in Suwan's data there. So perhaps it's time we abandoned translation and started learning from people who know how to have long and sustainable cultures. It's not a question, it's a comment.
Yeah, it's a very interesting comment, and I do really agree with part of it. That is that we need to focus on, for instance, non-Western ways of what can be called translation or not. But actually, important thing is that seeing how meanings are negotiated and translated with different conceptualizations may enrich our definitions, professional definitions of translation, that due to being verified and repeated too much, perhaps come to be limiting. So I do agree with you that sometimes as scholars of translation scholars, we look too much to translation as redeeming, and but it is true that translation is basic in communication in diverse settings. So it might be good to look at the dynamics in which it is involved. And yes, I do agree with you that we need to broaden our mind and perhaps take those visions, whether they are called translation or not, in order to, in my idea, revamp, for instance, our conceptualizations in professional domains, for instance, and in particular professional fields. This might be a way of enriching professional practices that are vital today in our super diverse societies.
Thank you very much. Does anyone have any comments or further responses or further questions?
I had my hand up. May I come in?
Oh, I'm sorry, I didn't see it.
No,
So
that's okay. That's
please
okay.
Go ahead, Claudia.
I wanted to, no, please. I wanted to piggyback on what Anthony said and offer also a different perspective. I think if we conceptualize translation as a situated practice, as we conceptualize interpreting as a situated practice, maybe what this is about there's a time and a space to engage with translation in the way of, as we have engaged in translation theory and reconceptualizing it throughout time as research informs our thinking. And Anthony's, your work is a wonderful example of that. And I think at this point, what we are seeing is, as a situated practice in a time of crisis, when it's important to communicate, to get the message across, then where it is translation, interpreting, translanguaging, code switching and whatnot, I think the most important thing we will all agree is to get the message across, and how we get it across with accuracy in terms of content, with adaptation and transcreation in terms of adapting to the audience, the reader, the listener, the signer, then it will all depend. But I think we have a place at the table with whatever name we use, whatever label we use. And I don't think translation will ever be lost. I think it is, or we need to disengage with it. I think it is adapting it to the task at hand. And in this particular way, at times it whatever it takes, but building on from translation and looking at it as a continuum. So that's my reaction. Thank you.
Thanks very much. Yes, I mean, I would only add that we can be talking about, what terms or what labels we use, what concepts we use, but, I tend to think that much of what we do in communicating with each other and trying to understand each other and affect each other, it involves translation of some sort, of course. And I think we're broadly sympathetic to that view here. I have a couple of questions here in the meantime. Apologies, my lock in the door was being replaced, so I was managing some sort of hardware crisis here. Now, coming back to the chat box, we had a couple of comments related to the plain language thread of our discussion. I can see the comment from Federico Federici. Hello, Federico, welcome. About the interactional communication and how much more effective it becomes. I had a question somewhere here. Please feel free to jump in at any point as I'm browsing through my notes.
So can I make another comment?
Please go ahead, yes.
Coming back to this point about whatever we call it, and what Anthony and Claudia were just talking about, but I do think the important point is also to underline this again. It's about quality, accuracy, and those things. And there I mean, that's not to say that all those forms that traditionally are not called translation are not accurate or by default not accurate. But I think we have to bear in mind that important distinction. And for me, that also means there is a role, as Demi was also trying to show earlier, there is a role here for trained linguistic professionals, translators, interpreters, whatever you call them, but for trained professionals to ensure that in these different forms of language mediation, we keep on message, because I mean that is of course also what all of this is about here, that we don't lose the message because the way in which it's mediated isn't quite so clear, right, in terms of what it is. So I think it's Anthony, I see your point. But I also think I do believe it is worth still making these definitions and being very clear about what is what. But I guess I have misinterpreted you, Anthony. Sorry.
Any response to Sabine's point?
Yes, I do agree with that, Sabine. I think what I'm particularly interested at is that precisely this somehow intuitive approaches to translation sometimes can help us better perceive the challenges in professional translation practices that sometimes might be obscured by too rigid professional definitions or somehow restrictive professional ideologies. So it is like a desire to be constantly questioning and problematizing our own like expert also discourses. I think this is the important point of thinking about what is called translation, what is not, and also what can still be translation, professional translation in the future, because our future is changing. For instance, now our future is much more intersemiotic, multimodal, etc., etc. So a definition of translation mainly focused on the verbal message might be restrictive. At the same time, in like super diverse settings, a monolingual definition of translation, I mean, a regime of translation which at the end privileges monolingualism might be also restrictive too. So seeing that, for instance, in Australia, there's a lot of going back and forth between languages. This type of translation is at the end multilingual, is like very inspiring for other institutional realms, for instance, in the West, I think.
Thanks very much, Sabine and Rosario. I can see two hands, Claudia's and Anthony's. I'm not sure if these are sort of heritage hands or...
No, Claudia was first.
No, it was a legacy hand from me, sorry.
All right. Thanks very much.
Piotr, I have a new hand, not a legacy hand. Can I just quickly chip in and share something else? I have to say that while we were doing this scoping review, I found it so fascinating that certain communities did prefer monolingual communication as opposed to translated materials. And that struck me. So I engaged in interaction with some of the producers of such messages in the UK, especially from the Southeast Asian community. And when I started talking to them about translation and the importance of translating materials into their local languages, their answer was, we don't want translations because translations don't work. Nobody is interested in translated materials because there is no trust in the source. And also from certain Black communities in the UK, I got the same input. And they even referred back to historical events when their trust as a community was really challenged by the way in which governments or even pharmaceutical companies treated them in the past. They talked about the Pfizer scandal in Nigeria, for instance. I mean, all these kind of things that have really shaped their trust in the source of this type of information. And as you said earlier on, I mean yourself, politicians, they're not to be trusted, apparently. And this has really shifted people's preference away from translation, and therefore they seem to place greater value in monolingual texts that are developed from their own needs, starting from their own needs, and do take their local context and local needs, religious, cultural needs into account. So I just wanted to add that this was also something, another body of evidence that we took into account. Thank you.
Fantastic. And I think that shows that, we as people, many of us working in translation studies have this sort of, ideal positive image of the subject matter, right? But for many people, as you mentioned, translation may mean something sort of, inherently inferior or artificial or contrived. Right, Anthony.
Okay, just quickly, in the data that I didn't get to present yesterday, We've got lots of community organizations saying bad things about translators and interpreters. It's also to get power and money for them. But I was in, AUSIT is the Australian Translator and Interpreter Association at their conference. And in the chat messages that circulate like we're doing here, so many bad things were being said about the community organizations who do the translations, but they're not really qualified to do it. They're not certified. So Rosario, it's not an academic debate. There's real tension within these communities there. Lots of jealousy, lots of misunderstanding between them, lots of rivalry. And the solution, I think, is to recognize, as has been said, translation and interpreting in the accuracy model is needed and it's good at one thing, but then there's a whole lot more that has to be done. And if others do it, if volunteers do it, if community organizations do it, I think that's really great. Okay.
I agree with you on the need to argue for the obviously professionalization of translation, to which we all, many of us, contribute as translator trainers, translator trainers. But we need to, I think, highlight the importance of accuracy. But my point was that we need to try to combine that also with additional values that need not to be seen as opposed to that, but with also creativity, working for accuracy, but kind of diversity, sensitive accuracy. So I think we might go to problematizing models, even of professional practice, in order to get better levels of quality in professional practice.
Thank you very much, everyone. I'm aware that we are at 11:06 at the moment, which means that we're running into our break time. Thanks very much for the fascinating discussion. Quite a few threads still open. We'll have more opportunities to talk. Please note down your questions and comments and bring them to the roundtable session at the end of the day. May I just remind everyone that the next panel will be starting at 11:30, so it's like in 25 or 4 minutes or so, chaired by Lorraine Leeson. And the presenters are kindly requested to come into the room a few minutes earlier just to test their presentations. A big round of applause, please join me for all our presenters, panelists, and participants today. Thanks very much for such a wonderful opening of the day, and looking forward to more discussions as we go along.
Hello, everybody. Welcome back. Good morning from Dublin, where we have determined that the sun is shining, unlike in London, where we otherwise would be. It is my great pleasure to be chairing the next session. And given that we have a tight schedule, we are going to move ahead with our first speakers. Our first presenters have actually been switched. So we are delighted to welcome, first up, Robert Adam and Jemina Napier, who are going to talk with us about lack of access to government COVID-19 public health information in BSL. And they're going to tell us about the prophylactic effect on the British deaf community. So without further ado, over to our lovely colleagues.
Okay, well, it's so nice to see so many green backgrounds here this morning. Look at that. Okay. Just give me 2 seconds and I'll start sharing the slides. Okay, everybody. Perfect. Well, Jemina, my colleague, and I are going to be giving a presentation about the lack of access, as Lorraine said, to the government coronavirus public health information in sign language and BSL throughout the UK. And we've called this, what was the prophylactic effect on the British deaf community? That's our subtitle. So first of all, we should talk about the language community we're addressing here. So we're looking at deaf sign language users in a unique position, really, in the UK. They are covered under the Equality Act 2010 and described as a disability group, but also because we use British Sign Language, we constitute a linguistic and cultural minority too. British Sign Language has been recognised, for want of a better word, but not formally in legislation. It's more the British government kind of saying, hello, we know you're there, but we're not actually going to do anything about it. We're not going to have any laws. And that was in 2003. But the Scottish government did enact the British Sign Language Scotland Act in 2015 in that country. So what that has meant, under the CRPD, the UNCRPD, which the British government has ratified, the deaf people have rights to public service information, cultural information in their first language, sign language. So through the coronavirus pandemic and crisis, this public health information of vital importance should have been widely acceptable. We know about the Black and minority ethnic community suffering through COVID more than the generic mainstream community. So what is the impact on deaf sign language users in a situation where there is piecemeal access to public health information? So what actually happened through the pandemic in the UK last year? Well, deaf people found themselves in a very untenable situation in terms of getting information. And the research that we've done has shown that there were so many barriers to information, including barriers to English in terms of healthcare information, the literacy levels of deaf people having a compounding effect on that. So deaf people as a minority community language group have always brokered information for each other and bridged information, shared information as a community. That's certainly community practice. But what we have to consider is when we're looking at interpreting studies, scholars starting to question and professionalize sign language interpreting service, but do we actually include the deaf community? Does this provide inclusion? Is it a one-size-fits-all attempt at a solution? And there is a long history of sign language provision and sign language access. There is legislation. So there has been a good history of sign language on television, particularly in the UK. Even the Queen has an interpreter for her speeches, for her Christmas message, for her subjects. So when the coronavirus pandemic started off, the expectation was that the deaf population in the UK would have access to this vital information equivalent to their hearing peers in sign language. That seems to have happened in Scotland and in Wales, but sadly not in England and therefore the UK. So deaf people were not getting timely access to this incredibly vital and life-saving information. Caroline Gebreau's presentation is going to point to the fact that there are interpreting services existing in many other countries, but sadly not at the behest of the UK government. So what we're then looking at is a systemic marginalization of a linguistic minority through the coronavirus pandemic. And we can see the impact that this has had. The community has launched its own campaign called #WhereIsTheInterpreter to try and get the British government to take responsibility for providing sign language interpreters at these all-important briefings. Now, BSL interpreters are actually available on the BBC News channel, the News 24, but there's an important distinction to be made in that when the news is replayed, repeated on all the other platforms, there is no in-vision interpreter because the interpreter is not in situ. So when these are rebroadcast and repurposed, because the interpreter is not next to the people giving the information, then the interpreter can be edited out or left out of these re-edits and rebroadcasts. Now, there's been a judicial review as a result of this campaign, and that is ongoing to hopefully, the results haven't been made public yet. The judge is considering evidence. The judicial review was just last week. So it's a very interesting time for our challenge to the UK government. The Prime Minister's response, Boris Johnson, was that there were a variety of logistical issues that got in the way. and they said that they would take things away and see what they could do. So this is the Prime Minister in Parliament making excuses several months ago and with no action taken since then. With that, I'd like to hand over to Jemima.
Great, thanks, Robert. So you can see on the slide that we are talking about prophylactic language, which really is preventative language. When we look at that definition, it means how to prevent something spreading, like illness, or how to prevent you catching disease. So prophylactic language really is about how language is used to disseminate information to prevent people from catching different diseases. And the government regularly use prophylactic language, and politicians use it in health messaging. And so we wanted to know about prophylactic language and how it could prevent the spread of COVID in terms of the deaf community, how it would prevent other diseases. It has many uses in health messaging and politics. So, you know, political language used by the government in connection with COVID was very strongly about this preventative message. I'm trying to move on to the next slide. Right. So really the important link is health information. Of course, language is very, very important. And on the slide, you can see research that has been carried out. One recently in Ireland. There was one research study into trust and translation, and about people being suspicious about public service translators working in Ireland through the pandemic, and whether they should trust the information that they were receiving if it had been correctly translated or not. And so we were interested in the research that had already been done linked to the COVID pandemic, and particularly in sign language. So one research question that had been asked was of interpreters, sign language interpreters. What has the impact the COVID pandemic been on your work? And it was actually Caroline, the next presentation, who's going to give the next presentation, who was involved in researching that area. And so they were asking interpreters about any changes that had occurred to their practice as a result of the pandemic. One publication looked into healthcare professionals who were deaf themselves and their experience of working through the pandemic and what that had been like. But so far, up till now, certainly in the UK context, there's been no research into the deaf community's experience of COVID and their access to the health information. Can I have the next slide, please?
Just to add to that, it's not only the public health information, it's also really access to medical professionals, to services, whether they have COVID or not, whether masks are being employed, distancing, all those factors coming together layer on top of one another. So, and we can't cover that in our presentation today. We're focused on just the public health messaging.
Absolutely, Robert, thanks. So Robert and we came up with our research questions for this linked to public health information. And we wanted to ask deaf BSL users about their access to the government prophylactic language that was used in terms of health messaging. And also, could they access the content of the public health information? What were the barriers that they had experienced? Were there instances where they weren't able to access this information? So a quick summary of our methodology. We worked with an organisation, a company called Open Inclusion, and that's a consulting company. And they were involved with the Where's the Interpreter campaign, and they were wanting evidence. So they asked Robert and I to be involved to create a survey, to design a survey that would be suitable for use with deaf sign language users. Now, there were problems with this because the survey was actually in English language, which is a limitation, but we did offer a BSL version of it if required, and we would certainly change that if we were to do the same again in the future. So 42 deaf BSL users responded from around the UK, and we contacted them through purpose of sampling and also through our own networks, we considered different ethnicities, gender, background, age, different demographic features. So we contacted our participants, and altogether there were 13 questions. Many of them were of the type that you agree or don't agree, mildly disagree, strongly disagree, the Likert scale. And then there were some open comments where people could write down their thoughts and their feelings. So we asked if people felt they had actually been able to access the information, which language they would have preferred to have the information in, how did they understand the content. Next slide. So we did our analysis of the survey. So we carried out a quantitative analysis, how many people chose this answer on the Likert scale and so forth. But there were only 42 respondents, so we weren't able to go into a deep statistical analysis of the results. But that gave us an overview, and we also carried out a thematic analysis of the key themes that emerged from the comments. We were very interested in this idea of prophylaxis, prevention, access, barriers. And then when we went down into a deeper level of analysis of what people had talked about, we found that the notion of tiers and bubbles was creating confusion within the community. So we selected that from the data as well. So we were able to give some examples of that from our analysis, which Robert is going to go on to talk about now.
Okay, so in terms of our survey findings, we did find that deaf people employed many and multiple ways of getting information. There was the government coronavirus information, the official information, which they found hard to find and then hard to understand upon finding it. The survey found that 64% of deaf people were concerned about their health and well-being as a result. And they actually preferred the information in British Sign Language. That being 90% of respondents of the survey saying that they wanted all the government information to be provided with a live BSL interpreter. 65% of deaf people saying that they wanted a BSL helpline, something that they could then proactively contact to discuss issues further. And for new concepts that kept evolving through the pandemic, such as tiers, the tiered system that was in employment. There was a 4-tier system in the rest of the UK, but a 5-tier system in Scotland. The R number in terms of rate of infection was very difficult for deaf respondents to understand. In terms of knowing where to get information and experiencing barriers, they looked at translations that were done through social media and from community groups, NGOs, and community organizations providing additional information in British Sign Language, not from the official government. So this slide talks to the ways that deaf people gain information. It's certainly not just one method. They find information in a variety of different modes. Social media, as you can imagine, was very popular. Captioned or BSL interpreted live briefings, and also summaries, as I've said, provided by these community organizations. So for example, there's a deaf health and mental health organization here called Sign Health. We also have the Royal Association of the Deaf, which is a community social services organization. They provided information in BSL because the government wasn't doing so in a comprehensive way. In terms of the coronavirus briefings, we found that they were very difficult to access. Only 14% of the respondents said that they were happy with the level of information they were receiving from the government itself. And you can see from the quote on this slide, the government website has no interpreted information into BSL at all. So I'm not able to find out about the briefings in any more detail. I can only access the summarized headlines from the news programs, is what that respondent said. Moving on, the information is also very difficult to understand. More than half of the respondents saying that the official government information about COVID-19 was either difficult or impossible to understand. And there's a quote here from a deaf person talking about this number of bubbles and households issue, and not understanding and having to ask their adult children and deaf friends for clarification. There was also concerns about personal health and well-being. 64% were worried about their personal health, their safety, and their well-being because they couldn't access the government information. It wasn't accessible or understandable to them. And this really gives us pause for thought. Obviously, we're all concerned about our health through such a global pandemic, but there is a specific concern that's at play here. This slide talks to the fact that BSL is naturally the preferred language, the preferred way to receive information by a fair margin. Many people think that providing subtitles on television is giving access to deaf people, but these results and these responses clearly talk to a different paradigm that's at play, deaf people much preferring to receive information in sign language. And again, from the quote, that way I can seek information and clarification. If it's only in written materials, it can be confusing and misleading even. In terms of the BSL interpreters at the briefings, very strongly, we can see that 90% of respondents want a live BSL interpreter embedded. So that means that when these are rebroadcast, that the interpreter is always envisioned, as we have seen in Wales, Scotland, and, as according to the chat, Northern Ireland too. So we can see that, in fact, in Northern Ireland, they managed to give these briefings with 2 languages, Irish Sign Language and British Sign Language. 69% of respondents said that they would also like a BSL helpline so that they can talk about health issues. And again, this is a quote from one of our respondents. When I was ill, I wasn't able to watch the live PM's announcements on the BBC News special. So instead, I had to lie on my bed, leaning on my arm, watching my iPad. And it turns out that you can't access the live BSL interpretation. It's only BBC One on the iPad, and you have to be on BBC News 20 or 24 News in order to do that. So therefore, that avenue to information was blocked. And again, you can't, there's another important point to make, that captions are an issue on iPads too, but the central issue for this part was more about the British Sign Language. So we talked about the tier system information and how difficult it was for people to understand it. It was easily the most difficult aspect of the pandemic information, 4 times more difficult than the next item, which was the R number. That was the next highest option for difficulty to understand. And then what's called the next best option is when we see deaf people finding BSL explanations and translations via social media, not from official government websites or channels. And it's like I mentioned before, organizations like Sign Health and others contributing to the community-generated knowledge about the coronavirus. Now, of course, when we then think about deaf-blind people, we would understand that there is an even bigger impact on people who are deaf-blind.
Do you mind us just giving her excuses, not her apologies for just having to leave? So just to let you know.
So the information not being available in Braille, not being able to see the interpreter provides an extra obstacle and compounding factor for deaf-blind people. And you can see from this quote, the deaf-blind person saying that it was difficult to access information. They can't access written information. They're relying on family members and other people. And this person is saying that they work with deaf-blind people and talking about the retranslation and the reinterpreting that had to go on in this piecemeal fashion. So deaf-blind people, we've heard anecdotally, have been to, they've missed public health information. They've ended up in hospital with coronavirus, not knowing what is going on with them. Because the kind of support that they need, hands-on support, requires close physical contact. So when they are admitted to a hospital, they can't see an interpreter, the masks, the PPE, everything you can imagine, these compounding factors, leaving deaf-blind people incredibly isolated. And again, this is another quote, "I'm just totally disappointed with this government. I hate that Boris Johnson does not ensure that his social media is accessible, not even subtitles. It feels like they don't care about deaf people. And when they're asked why they can't provide access, they come up with ridiculous excuses like social distancing." And another respondent here saying that they feel that they've been failed. The deaf community, the government hasn't met its responsibilities under the Equality Act, and they haven't made these reasonable adjustments. So really the key messages out of this, well, really it's not just the language used, the concepts are confusing, but also the system. So, and deaf people found all of this confusing during the coronavirus pandemic. And the lack of access to BSL, plus the information overload in an inaccessible language format impacted and has impacted on deaf people's understanding and therefore their well-being in this context. Our conclusions being, as you can see from this slide, that the key barriers for deaf BSL users during the pandemic was a lack of access to public health information in BSL. And secondly, also the government's prophylactic language used to prevent the spread of COVID backfired with deaf BSL users because it became a prophylactic in itself. It drove people away. It prevented them from understanding and accessing this vital public health information content. And with that, we're done. Thank you.
Thank you so very much, Robert, and to Jemina also. You were incredibly efficient in terms of time management, so thank you also for that. Perhaps in order to move along, we will now invite our next presenters. We've got Caroline, Lean, whoops, that was my little 1 minute warning kicking off there. We have Caroline, Lean and Haron, who are our next presenters. And they are coming to us from sunny Belgium, perhaps it's sunny there too. And they're going to talk to us about, finally, it was time to provide an interpreter, a multi-party perspective on the provision of sign language interpreters at the COVID-19 press briefings in Belgium. So, lovely presenters, over to you.
Hi, unfortunately not sunny at all in Belgium. Just checking whether everyone can see the slides and the interpreters. Caroline is nodding, so okay, perfect. Hi, so my name is Lien Vermeijden. I work for the National Crisis Center in Belgium, and I'm here with Caroline Gebruurs and Jaron Garite, two of the interpreters who provided signed language interpretation for more than 160 press conferences on the coronavirus in Belgium. So together we wrote an article on exactly this, so the provision of signed language interpreters during these press briefings. Seeing that my slides doesn't seem to, there you go. So just for a little bit of background information, the coronavirus crisis hits its first peak in Belgium on the 12th of March 2020, when Prime Minister Sophie Wilmès announced the first lockdown. In any kind of national emergency, the National Crisis Center will form the Information Cell, which is a team responsible for official crisis communication. For this crisis, it consists at its core of the National Crisis Center, Federal Health Department, and Cienzano. Together, we manage the official website, organize the press conferences, the information helpline. We had regular meetings with stakeholders across all governmental levels and so forth. The coronavirus crisis was unprecedented in Belgium, both in terms of scale and duration. The virus, as well as the measures to stop the virus, had an impact on the whole of society. So our list of target groups, stakeholders, and demands for adapted communication channels were never bigger. We've tried to adopt an inclusive crisis communication approach as much as possible by providing easy to understand language and accessible channels, and adding extra tools and services where needed, such as text rewritten in plain languages, translation into up to 20 languages, and so forth. Specifically for deaf signers, we provided videos in Flemish Sign Language, French Belgian Sign Language, and German Sign Language. So it's important to know that Belgium is a multilingual country, both in terms of spoken languages and in terms of signed language. So we have Flemish Sign Language in the north, French Belgian Sign Language in the south, and there's also a small part where German Sign Language is the main sign language. Apart from the videos, there was live interpretation during the daily, which became later weekly press conferences on the coronavirus, live interpretation into Flemish Sign Language and French Belgian Sign Language. This was a first in Belgium, both the fact that there was live interpretation as the fact that it was being done by a co-interpreting team. So you saw the deaf interpreter on screen. So that's why we decided to do a small research, Caroline, Jaron, and I, on how this practice was received. So before we go into the results, I will give the floor to Jaron, who will explain more how this co-interpreting team worked.
Jaron, it's your turn. Yes, just a second. I'm searching for the interpreter. Okay. On the 12th of March 2020, the Prime Minister Wilmès announced a lockdown in Belgium. We didn't have any experience, so this lockdown happened, and the crisis center realized there weren't any interpreters, so they contacted two deaf people, a deaf organization, and they told that they needed interpreters. They wanted a hearing interpreter as well as a deaf interpreter. A deaf interpreter was an addition to the team. They made a co-interpreting team, and we interpreted for the National Crisis Center, as well as the press conferences by the First Minister. Can you go one slide back, please? The slide before this. One back. Yeah, thank you. I will explain how we worked on site. So there's a conference speaker. Now there's a deaf interpreter. You may wonder, how does this work? Well, next to the camera, there's a hearing interpreter. So the hearing interpreter receives this auditory input, then puts this into sign language, and that way the deaf interpreter can sign. So this is how we work on site. You can see a visual representation of how we worked here on this slide. Now the next slide. So there are two locations where we worked. The first one was the National Crisis Center. So we explained or we interpreted how Corona went in Belgium, how many people were hospitalized, how many infections there were in Belgium. So in the beginning, this was daily. These press conferences were daily. And then the second venue is the next slide. You can see this on the next slide, is this one. So this is the Prime Minister's press conference. So this is about the measures, what you can do, what you can do. So these were the two venues the co-interpreting team worked at. Next slide, please. Now I give the floor to Caroline.
Okay, so we researched if there was any prior research about interpreters in media settings or interpreters in crisis communication. So we researched which research has been conducted before. And yeah, next slide, please. And then we decided to do our study. It was the first time that there was a co-interpreting team of deaf and hearing interpreters in Belgium. So our focus is on the situation in Flanders, but we wanted to find out how this practice has been experienced by two groups. Firstly, a group of deaf and hearing viewers, so the service receivers, and also another group of service providers, like the conference speakers or interpreters themselves. So it was our aim to have a really multi-party perspective in our study. Next slide, please. We conducted this research. It was a qualitative study, and we had 10 interviews during the period October 2020 until January 21. We focused on different topics in both the groups. Firstly, like whether there was any prior knowledge of sign language and sign language interpreting, and did they have experience with sign language interpreting, seeing or working with. Also, we were interested in the personal impact and on the future ideas and aspirations. The participants in the study, it was a study of 10 participants. There were six service receivers, 3 deaf viewers and 3 hearing viewers, all from different backgrounds and age categories, and also the service providers, 2 conference speakers from the conference, a scientist and someone who was responsible for communication, and 2 interpreters, 1 deaf and 1 hearing. We gathered all these results and we made a thematic analysis. And on the next slide, you will see our findings. We focused on the visibility of sign language and deaf interpreters. We also wanted to know what the viewing experience of people was and how the collaboration went. And also we had some ideas about future of sign language in crisis communication. And Jaron will go in depth on different topics now.
Yes, the first theme is about the visibility of sign language and deaf interpreters. You have 2 groups, as Caroline mentioned. So the press conference speakers said at the beginning they saw the co-interpreting team working and they didn't know why they were switching positions. They thought sign language was universal. So we told them there were 2 French-Belgian sign language and Flemish sign language. But at the beginning, they were very confused. But now they have an understanding of how we work. They also have an interest and they realize the added value of having a deaf interpreter. And then the second group, the deaf viewers, they said they felt there is a great difference between before and after the press conferences. So after, they feel like they receive a lot more respect by hearing people. Also, one student said that at school, the teacher has a lot more respect for sign language. Then the second finding was that these deaf viewers have a feeling of connection, a feeling of sameness. They see deaf interpreter and they feel connected to this deaf interpreter and they feel less isolated because everyone had to stay at home at the time. And by seeing this deaf interpreter, they feel a connection. They feel like this deaf interpreter is present, really. And the second finding was that they really felt empowered, very proud. They see the equality. There's a deaf interpreter on screen, and it's important to show that deaf people can do this job as well. So they felt very, very proud. Next slide, please. So during the pandemic, we interpreted, and there was a lot of media attention. People wanted to do an interview. I think there were more than 10 interviews or things we did. Before there was nothing, but after the press conferences, there was a lot of media attention. This is very good, as hearing people now have a greater awareness. At the beginning, they thought it was a hearing interpreter, but because of these interviews, they realized it was a deaf interpreter. So that was very positive, this media attention. Also, something I want to add is you can see the picture with the green screen. Have a nice weekend. This is one of the conference speakers who signed this at the ending of the press conference. This was live, and this person signed, have a nice weekend. Then the second thing was that we were interpreting the press conference by the first Prime Minister regarding the measures. And afterwards, he thanked us. He thanked the team, the co-interpreting team, for their work. He even gave flowers. And this on live television, so we felt like we finally received recognition for what we did. It gave us goosebumps. Next slide, please. Then the viewing experience. This is the second theme. The hearing viewers, we asked them, you have 1/6 of the screen. In 1/6 of the screen, you can see the interpreter. Do you think this is bothersome? And none of them found this bothersome. They said, there has to be an inclusive communication. There has to be a deaf interpreter. This is logical. So it didn't feel like it was disruptive. Then deaf viewers who watched this deaf interpreter felt like this was a lot more fluent. There were facial expressions. Even one person said that they feel like hearing interpreters are more square, it's a metaphor, more stiff, whereas a deaf interpreter is a lot more round, a lot more fluent. Yes, next slide. Now, Caroline.
Okay, we saw different positive impacts, but also quite some limitations. Firstly, the broadcasting of the press conference was online, so people with limited access to internet, like, for example, elderly deaf people, didn't have access. A second limitation, sometimes a press conference was also shown on the national TV, but sometimes they showed only fragments, and then the interpreter got cut off early because of the processing time. So some people were quite frustrated about that. And a third problem that occurred was that it was good to have interpretation, but there's also a need for direct communication. So in Flanders, you have one deaf-led media company, which is called Visual Box. And some volunteers worked over there to make summaries of the news on Corona. And a deaf person who was interviewed said, I really like watching the press conferences, but I also like to see the summaries of Visual Box to double check the information. So that I'm sure that I right. The next slide about the collaboration. There was a collaboration between conference speakers and interpreters, and I think there was a mutual respect, also a willingness, openness. In the beginning, the report evolved over time. In the beginning, there was some none to little preparation, but afterwards the interpreters received all full text, which was very good. But evidently it's live TV, so there are always unexpected challenges. Also, we saw that when there were new speakers, the organization really briefed them and said it's important to speak a little bit more slowly and give them practical information. Also, Jaron briefly explained before, there was a signing space, so people wanted to know some signs, like the sign for good weekend or their own name sign. They saw the deaf interpreters at work, and they wanted to know more about sign language themselves. There was maybe one disadvantage. Some speakers said, there's a position switch of interpretation, and sometimes this interrupts the flow of speaking, but this was a minor disadvantage. Also for the interpreters themselves, they said it was, they felt it like a very big responsibility for conveying the correct information, and it had a big impact on themselves. But they felt, at the same time, they felt very resilient and supported each other. And what's very important in the cooperation between deaf and hearing interpreters is that there is a mutual respect, there is equality, there is trust between the interpreters, and they are aware of each other's capacities and limitations. And I think it's also important that there is a match between the interpreters. It's like some sort of chemistry, let's call it. It's not just one deaf interpreter and one hearing interpreter put together, but there has to be some match between them. Next slide, please. Okay, I'm watching the time. So then our findings about the future. We know that the deaf community is very diverse, and it's a big challenge to match the communication for this diverse group. Interpretation is important, but at the same time, it's also important to have direct communication in sign language. And if there are future crises, maybe also at local level, maybe there will be some financial limitations to provide always sign language interpreters. Also, preparation, there has to be some preparation time for interpreters. That's something that we have to have more about. And also in Flanders, there's only a very small pool of deaf interpreters. So there are no interpreters working at the moment. We have a broad experience, so it's all quite new. Next slide. So our conclusion, in general, it was a very positive experience for all participants. It was only a small scale study, so we have to do a bigger research to find out more. But we see that in Belgium there has been a big visibility of interpreters, and we are interested to know if this will lead to more awareness in the future. And we also hope that the best practice of interpreters during the press conference will just become a part of the new normal in the future. And maybe one last slide. Jaron will explain about this.
Yes, indeed. So we worked with a Flemish Sign Language team, Belgian Sign Language team. And as well in Flanders as in Wallonia, there were deaf-led media companies who made documentaries. So the first one is Visual Box. They made a documentary on the beginning of the corona pandemic and the experience of one deaf interpreter. So you can watch this documentary. You can see the link, so you can watch it with subtitles in Dutch or in English. Then the second documentary is a documentary by Musk. This is also about the team, the French-Belgian Sign Language team, and you have subtitles in French, Dutch, and English. So you can watch this documentary as well. Next slide, please. Here you can see our contact details and also our names. So if you wish to contact us, you have a mail address and some other contact details. Thank you for your attention. And if there are any questions later on, you can ask them, of course.
Wow, that was so interesting. Thank you all so very much indeed. I know I've been scribbling away some questions here, and I'm sure that there are going to be quite a lot to follow. Piotr, we have a few minutes. Do you think it would be okay to ask a question now, or would you like us to move ahead into the next presentation?
However, well, it's up to you, Lorraine.
The power, it's wonderful. It's going to go to my head.
Yes.
Okay, well, let me, Caroline, can I ask you a question while you're there? You talked about preparation that the interpreting team did, and given the multilingual nature of your team and the deaf hearing makeup of the team, I'm just wondering if you could say something perhaps about how you handled the development of new vocabulary.
Yes, okay. It's a very good question, Lorraine. I think it was an interesting setting because there were two interpreting teams working, one Flemish sign language and one French-Belgian sign language team. And there were always, in each team there was one deaf interpreter and two hearing interpreters, so 6 interpreters in total. So we always received the text in Dutch and in French, and we discussed among each other about the signs, but we also exchanged information with the other team. And also it wasn't only our team, but we also had contacts with the deaf community to ask about some signs. Other deaf interpreters, other deaf people. Sometimes just minutes before the starting of the press conference, we called somebody and asked for a specific sign. So that's how we handle it. And also we contacted some colleagues abroad, but we didn't make decisions ourselves about signs. We always consulted with other people. And the communication among the teams was also very interesting, because sometimes it's national sign, in English, in French, a mix up of all sorts of languages. I don't know, Yaron, maybe you want to add something?
Yes. In the beginning, you have the French-Belgian team and the Flemish sign language team. In the beginning, we didn't have any contact, but because we work together so often, there's a lot more contact. Also, it's a visuals language, so we can use some signs from the other team. And that's really a forte that it's a visual language, that we can work together. So that's beautiful. Also, you have hearing interpreters in the Flemish team and deaf interpreters in the Flemish team, as well as in the French-Belgian team. And it was a good connection, yeah.
Maybe I can add some small remark. It was also interesting to know that at a press conference, there is also always a switch of language. So they start to speak in Dutch, and then the next speaker is in French. So also for us, we had a chance to see the interpreter in French Belgian sign language is using this sign. So maybe we can integrate it into our interpretation.
Yeah. Plus, I would like to add something. The conference speakers, we don't feel like they were unreachable. We felt there was a connection. Also, they adjusted their tempo. It was a good collaboration, honestly, because they really adjusted their work to us, and it felt like it was an inclusive way of working.
Thank you. That was just wonderful. I have loads of questions for you around all of the work that you have presented on, and indeed for Jemina and Robert too. But now we must move along. Thank you very much again. I really appreciated your presentation, and I can see from the chat that all of our other viewers watching from around the world do too. So without further ado, let's move along and welcome our final series of presenters for this morning. We have, I believe Claudia actually is going to be presenting on behalf of herself and Gerardo, and you are going to tell us about implementation of the Peruvian Indigenous Languages Interpreting and Translation Center as a compliance of linguistic rights strategy in the Peruvian healthcare system during the COVID-19 pandemic. Over to you, Claudia. I look forward to your presentation.
Thank you. So I'm going to try to make it on time. We have tons of things to say, but let's hope we make it. So today we're going to be presenting this specific Peruvian Indigenous Languages Interpreting and Translation Center. Originally, it was only on the healthcare system, but there are other institutions involved as well, and I'm going to explain a bit about it. So what we want to talk to you about today is we want to present the implementation process, how it started and how it developed and what it's going on now, and some relevant ideas around it. Because it's just a new implementation and recent implementation, we're just going to go over the story and some important aspects of laws that made it possible. And so first, I'm going to talk a bit about the Peruvian language diversity. So I can tell you about how many languages are spoken here in Peru, so it's understood how many languages were involved and so on. And also the legal framework on language rights, specifically for indigenous languages. So there's over 7,000 indigenous languages around the world. And there you can see Peru, we're in South America. And in Peru, 48 indigenous languages are spoken. So we have 50 languages: Spanish, the Peruvian Sign Language, which is worth mentioning because of the presentations we've had, and 48 indigenous languages. Now, you may know this, but Peru has been one of the most impacted countries for the COVID-19 pandemic. So we have had a high rate of deaths, and lots of people have been affected by it. People have lost their jobs and they have gone poor. But even in Peru, the pandemic has not affected the same way, has not affected everyone the same way. And it's important to point out that in 2020, the United Nations identified COVID as a new threat to the health and survival of indigenous people. So among all population, indigenous peoples were a specific population that is more affected by COVID because of how far they are from the cities, how difficult it is to get medical attention. It's not only in Peru, but in many parts of the world, because of information gaps, language barriers. So if the indigenous peoples are the most affected ones, that meant that 55 of the identified indigenous peoples here in Peru, which is 26% of the population over 3 years old, were specifically affected by the disease, not only because of the reasons I've mentioned, but also because they couldn't get attention or information in their languages. Out of these 55 indigenous peoples, 4.5 million people here in Peru are indigenous languages speakers. So that is 16% of the population over 3 years old. And we have 48 indigenous languages, 44 in the Amazonian region and 4 in the Andean region. And there are 19 linguistic families. But out of these languages, out of these 48, 27 are safe. That means that the language is passed on through generations. 3 are in danger and 18 are critically endangered. This is important. It is an important piece of information because I'm going to explain how the level of vitality of the language affects the number of interpreters and information provided in the languages. But it's also important to know there are 5 indigenous languages that are the most spoken ones here, which is Quechua, and Quechua has different variants like dialects. There's Aymara, Ashaninka, Awajún, Shipibo Conibo, and Xavi. Quechua and Aymara are Andean, and Ashaninka, Awajún, Shipibo Conibo, and Xavi are Amazonian. So this is a bit about the language diversity. But it's also important to give an overview of the legal framework. over the last 10 years, here in Peru, many measures have been taken in the legally, but also on the government at an organization level to protect indigenous languages and indigenous peoples. So one important starting point was the enaction when the law of indigenous languages was enacted. So that was in 2011. And over these 10 years, we have seen different measures. Like, for example, in 2012, the government started training indigenous interpreters and translators. And then the Directorate of Indigenous Languages was created, and many other steps that I don't want to go into details because of time, but there is a national registry of indigenous interpreters and translators. There were other laws. There is a policy for indigenous languages, and many other measures. And recently, the Peruvian Interpreting and Translation Center that I'm going to be talking about. So how it started and what services does it provide? Well, during the start of the pandemic, because of indigenous people were identified as the most threatened ones by the pandemic, a problem was identified that there was a limited timely assistance to the population that speaks these indigenous languages in emergency context. And this was worsened by the lesser access to communication and information that this population had. And there were no means of doing a proper follow-up or monitor the situation in these areas. So as a strategy to prevent this, to face this, the Peruvian Center of Indigenous Interpreting and Translation Center was launched. And they aim now to address the needs of for interpretation and translation in indigenous languages. And so this service is provided in emergency situations. So it's free, but only for emergency situations. And there are certain institutions that are prioritized. I'm going to go over it in a minute. But it's important to know that this was a government measure, and because it was launched from the government, there were specific legal instruments that were enacted. From the very start of the law of indigenous languages until some supreme decrees that created the service, and also the protocols and instruments that the service was going to use. And so we have different stages around that were issued last year, from March, but up till September last year, it was officially created. And from that moment on, the service has been provided nonstop. So about this center, who are the direct users? Well, the direct users are public servants from public services and social programs prioritized in emergency situations. So they can contact the center, but the final users are the Peruvian citizens who speak indigenous languages and use public services and social programs, which are prioritized in emergency situations. And there are three special services or modalities that are offered in this center. On-site interpreting, which is limited because of social distancing and because of how far these communities are. Over the phone interpreting, which was the reason what it was originally created, and translation, which has been proved as the most used service because of the needs to create and disseminate information in indigenous languages. So it belongs to the Ministry of Culture, specifically in the Directorate of Indigenous Languages. And as it's shown here, it was created for emergency situations. So these are the three modalities: on-site interpreting because of COVID, and because it's also quite delicate to go to communities because the virus could be carried and it could affect the community. On-site interpreting is provided only in exceptional cases when it's just impossible to provide over the phone interpreting, or it's really necessary to provide an interpreter on site. And then is over the phone interpreting. I think many here are familiar with this concept. It's a service that has been developed for public service interpreting from the 70s, but in Peru it was not so popular because we don't have other languages migration as strong as in some countries like in the UK or Australia or New Zealand or the United States, where these services is widely provided. But this is one of the important services that it provides over the phone interpreting. And translation, which is specifically for specific information production for, it could be posters or small recordings on how to prevent, what measures to take. And how does it work? Well, there's a specific group of people who work in this center. There's one general coordinator. They receive the demands, but they also deal with public institutions. There is one interpreter out of the team, interpreter and translator, who is the coordinator of them. So this person delivers the translation requests and make sure that she does a follow-up. But there's also one specific person who is the liaison with the freelance interpreters and translators. She coordinates with them. I'm going to explain what that is in a minute. There are 8 in-house interpreters and translators. So it's a team of 8 people in the most spoken languages, 6 of them. Why 6 and 8 interpreters? Because we have Quechua in 3 variants: Chanca, Cusco Collao, and Ancash. Chanca and Cusco Collao are in the south of Peru, and Ancash is just north of Lima, but they are the most spoken variants here in Peru. And so there are 6 languages that are hired on a permanent basis, but this center also offers the possibility of contacting in some other of the 37 indigenous languages that are spoken by the interpreters and translators registered in this national register that I mentioned earlier on. So not only there are 6 languages permanently provided, services provided permanently in 6 languages, but you can also call the center, and if you need an interpreter in other of these 6 languages, they can contact them and make sure that the service is provided. And these are, I'm not going to go over them because I know we are short of time, but these are some of the protocols or instruments that the translators use. And as you can see, well, it's in Spanish, sorry. But there are specific protocols on how to contact interpreters, how to deal with, well, this is for over the phone interpreting, sorry, because of the Zoom window, I can see it. This is for over the phone interpreting. So there are specific protocols on how to provide on-site interpreting or over the phone interpreting, what information to complete, and there's a specific system. So all the attentions provided are registered and processed, and there's a continuous oversight of how the services is going and what needs to be improved and so on. And let's see, what happened? Here. Okay, and these are some protocols and instruments for the translation service. My bad. And so, as you can see, there are some specific details to complete about the translation, from whom, which institution is providing the service, what topic, the context, the number of words, what type of text it is. And so these details are needed for the translators to try to be as most accurate as possible. And there's also what we call here, specifically here in Peru, as to indigenous languages, a validation instrument, which means that they talk to other translators of the languages or people who speak the language to validate information, because just like in the case of sign languages, there is always a gap from new terms or specialized contents. It's quite difficult to translate very abstract concepts or words or new words that come up. And so the translators need to work constantly with other people who speak their language or other people who translate, because sometimes even translating mask or, I don't know, virus or even coronavirus or respiratory syndrome, things like that could be quite problematic. Well, so what is the trial phase of implementation? I mentioned earlier on that it started in March as the design phase, and it was officially launched on September. Well, so far there is a trial period going on. We're monitoring how the service is working. And as I've mentioned, there are 8 languages that are working in the center, and they represent nearly 98 of the total of 4.5 million speakers of indigenous languages in Peru. And what is prioritized is the over-the-phone interpreting and the translation services. The service is provided 24/7 and 24 hours. And there are some prioritized institutions as the Ministry of Health, the Social Health System, but also the Ministry of Social Development and Inclusion. And many other institutions have contacted the center so they can receive some attention, some services, some translation services. So it has been quite challenging, but also a rewarding experience to see that more institutions are realizing how important it is to provide information in the mother tongues of the population, which they do not only speak Spanish. And so here you can see how the assistant route works. There's a phone number that they can call, and they can choose which service they want, or over the phone interpreting, translation, or maybe orientation, which is an option for public servants who are not aware of the language diversity where they work. Maybe they know that there is an indigenous person that has come to their services, but they don't know what language they speak. So they can contact the center, and a coordinator will try to figure out what language is the person speaking, or maybe provide further information on the diversity on the population or any other matter that may arise. And so they can choose which language they need. And there's an option for, apart from the 6 languages and the 3 variants of Quechua, there's a 9th option when they need an additional language. And so, where am I? So what has been the delivered assistance today? I'm going to go quickly over this. first of all, there has been a strong work on promoting the center. Leaflets and posters and videos have been launched. But also, as you can see, there are many, these are the institutions that have requested translation services. So it started as a health or emergency situation, but many other institutions are in charge of disseminating information for the indigenous people. So there has been tons of requests from them. And here are the number of translation delivered per language. And as you can see, out of the six prioritized languages of the center, those are the most ones provided, but there's also a significant number of other indigenous languages in Peru that have been also assisted by the center. And these are the different services in translation that the center has provided, not only translation, but also recording of messages, because in indigenous languages, well, not all indigenous languages speakers know how to write or read in their languages, or are not so familiar with the reading way, and they need oral information, which is it's easier to disseminate. So there has been tons of programs that have been recorded about it. And there's also been proving, editing, transcription, text analysis, style correction. And over the phone interpreting, these are the institutions that we have worked with, the judiciary system, but also specific hospitals as to cancer diseases, or the Children's Hospital here. And these are the languages that have requested, or in these languages, services of over the phone interpreting have been requested. And just to summarize, as to translation, 37 institutions have requested translation services in 38 indigenous languages and variants. And there have been 2,039 request deliverables. And as to over the phone interpreting, 5 institutions have been assisted in 3 indigenous languages and variants, and 8 services have been delivered so far. So translation has been the most popular one so far. And just some relevant ideas. This experience in providing interpretation and translation services for emergency situation is probably the first experience in Peru and Latin America, and many other in indigenous languages. I think Australia has specific services in the northern region, but as to indigenous languages, this is a leading experience. This experience seeks to guarantee the rights of all Peruvians to use their indigenous languages in government agencies or instances, which is defended by a constitution, but sometimes it doesn't happen. So this is an effort to make sure that happens, that they can receive attention in their mother tongues. And it seeks to benefit 98% of the total 4.5 million speakers of indigenous languages in Peru. I would like to add some things to it. On the bright side, it has also helped institutions realize the need for translation and interpreting and the positive impact of providing these services. And now other institutions, or these institutions, are requesting more and more services, and the population has started to realize how important it is to guarantee the linguistic rights, and has also opened a space for the professional development of interpreters and translators in indigenous languages. So 9 years ago, the government started training interpreters and translators, and now there are specific spaces where they can work 24/7 or on a permanent basis, and this adds a value to their training and their language and identity. So up to here, Gerardo and I would like to thank you in different indigenous languages for the attention paid and the space provided. Thank you very much.
Thank you so much, Claudia. That was really, really interesting, and there's so much food for thought there. Could I get you to hang on, and could I welcome back our other panelists, if you would like to join us? And dearest friends from around the world, whether you're day or night, whether it's sunny or raining, feel free to pop your questions into the chat box, or if you stick your hand up, I will try and spot you. Well, while we're waiting for our lovely audience to get started, Claudia, could I ask you a question actually about the interpreting service? Is the plan that this will remain in place, or was it envisaged as something just for COVID times?
Well, it's already created by the legal framework. Sorry. But so the plan is that this service does not stop. The thing is that because it's provided by the government, evidence needs to be created. So we have to prove to the government that it's actually a positive thing. Fortunately, that is happening because the service is being well received by the institutions. And we hope that over the next years, when the pandemic is over, other institutions will continue to seek these services. It's created for emergency situations, but well, I'm sure that the health sector will continue to need this interpreting.
That's wonderful. I see that Marcia has her hand up. Marcia, you have a question for the panel?
Yes, perfect.
Okay, I'm going to assign this an international sign. Really fascinating, wonderful presentations from everybody. My particular question is for Robert Adam. Okay, Robert. One thing that you said really struck me and fascinated me. You said that the most difficult thing for deaf people to understand, the deaf viewers, and there were a number of different vectors, 1, 2, 3, and 4, or no, the tiered system, sorry, being the hardest thing, plus the R number, the reinfection number that we've used in lots of countries. So I was just thinking that what was the easiest to understand? You know, you've talked about what's the most difficult to understand. Can you perhaps explain or talk to why that might be the case? Any thoughts? Andy, I'm going to use international sign. Okay, so I'm going to respond in international sign. So stay with the same interpreter. That is an interesting question. There's my personal view on that, and then I have a political opinion. Well, which is a political opinion, and then the second, which is structural. So first of all, my political personal opinion is that the British government is now is a libertarian government. Yeah, that's their philosophy. They're working within a libertarian frame, which means that the government passes on responsibility to individuals and society just to get on with stuff. You choose how you get information, what you follow. So I think that with a government giving information within that, through that lens, within that frame, they think that people will have agency to make choices. And of course, when we then think about what's available, they have only considered compulsory information and not additional information. The other problem is that I know that in the UK, there are a number of different health bodies, health organizations in the major cities. And of course, we're having different tiers in operation in neighboring towns and cities. So for example, I live in Edinburgh at the moment, and in Glasgow, we have a very different level of restriction and lockdown regulation and guidelines. And I think that that has added to the confusion. Not only have we had country borders, then we add into the fact that you've got most of the information is in the English language. You have a complex multi-tiered system. So I think all of those things compound together making it really very difficult, where you've got a government's political expediency, overuse of English, an overcomplicated tier system that isn't explained in terms of what people can do in their house, out their house, bubbles, how many different people. So it was very, very complex tiered matrices information and needed a great depth of explanation. So there was nothing complementary going on. I hope that has answered your question. Yes, it has. Thank you.
That's wonderful. In the chat, we have a question from Helen Kelly Holmes, who says, thank you all for these great papers. And she notes that in Ireland, and I won't be correcting you, Helen, because you're absolutely correct, but she says in Ireland, we have also had sign language interpreting at briefings. So this means that sign languages are far more visible than usual in mainstream media. But what she has noticed is that this is only where there's a briefing by health authorities or a joint briefing by health authorities and a politician. When there's a briefing by a politician on their own and or an address to the nation type event, I haven't seen sign language interpreting used, she says, and this makes me wonder if this will result in a continued framing of sign language in terms of health and disability, rather than embedding this as a language right, and that this will limit the potential long-term positive effects of the prominence of sign language at the moment and political gains in terms of mainstreaming. So I think this actually builds on your response there, Robert. But I wonder what our panelists think about that. Do you feel that the way interpreting is provided in mainstream media is adding to the framing of interpreting and of deafness in particular as a sort of a healthcare issue, as a condition that needs to be addressed? Do you have thoughts? Who'd like to respond? Oh, you're all very... Caroline, you have something?
Well, yeah, is the interpreter seeing me? Okay. Well, I think, no, I'll start my sentence again. In Flemish sign language, for Flemish sign language, it's too early to comment on this. We have to see what the effects will be. We gave our presentation and we gave an overview over the past, and we see that there sometimes interpreters were simply forgotten. For example, in the Antwerp region, the province of Antwerp, in the summer, there was also there were a set of specific measures, rules, and there was also a press conference. There were no interpreters provided. So the deaf people from Antwerp were like, "Hey, where are the interpreters?" On the national TV, we have interpreters, and now on the regional level, we're sitting watching our screens, and there are no interpreters visible. So I think it's all it's like how they see deaf people and disability, and I think it would be a very interesting topic to research in the future, so to see what the results.
Yes, I would like to add something to that. In Belgium, there's a complex situation regarding languages. You have Flanders, Walloon, and you have the German community. You also have federal. You have a federal level. You have national level. So there are a lot of levels, and sign language has to be present in all these levels. So this is a very complex situation in Belgium. Yeah. If there was one language in Belgium, I think it would be a lot more easier. But here it's so complex with the different languages.
Brilliant. I have a question for Claudia from another Claudia, from Claudia Angelelli. So a question, could you expand a little bit on how interpreters are selected, trained, and how quality consistency is considered across the lenguas originarias used? I hope I haven't killed that question on you, Claudia.
No, it's all right. Thank you for the question. So the training of interpreters and translators in Indigenous languages started in 2012, and it is provided by the government. It's a specific training which has different challenges and limitations because of time and resources, but it's focused on public service interpreting and translation. So they are trained in this specific area. And this is an area that is not provided in Peruvian universities that teach translation and interpreting, because how this market works in Peru is a bit different. Here in universities, students are trained for legal or medical or scientific translation. But as to Indigenous interpreters and translators, the government first prioritizes public services and interpreting. It's a bit challenging. It has always been a challenge for the Peruvian government, but it also has a different selection process because they are people who already work as translators and interpreters. And so specific tests are made to see their domain of the language, written and orally, how their opinions on translation, their qualities for translation. And after this selection process has been made, because it's a public call to all speakers of Indigenous languages, and many of them apply, and there's a selection process, then they are trained for a month period or certain hours in public services and translation. Now, quality consistency is always going to be an issue in Indigenous languages because of the differences, the breaches between more spoken or farther or majority languages versus minority languages. So Indigenous languages have had less spaces for the development of terms, specialized language, and that challenges translators because there are also not many resources to do some research. And so quality, consistency are measured in different ways through retranslation or validation processes with speakers. So it's talking about training of Indigenous languages could be a topic that we could talk for a long time because it presents challenges that training in foreign languages do not see. They face challenges that I have studied translation and interpreters, and the challenges they face because of the distance between languages are challenges that I have never had to face in my career. And so, yeah.
I think actually, that would be a really good topic for another whole conversation. And I think that your experience around the training of Indigenous speakers of languages, I think it would be very interesting to see what those who have been involved in the training of deaf interpreters would have to say around potential parallels, because there's also the huge modality shifts that are required. I'm afraid we have come to the end of our time, despite the fact that there were other great questions. So one for you to go away with and maybe respond in the chat on is how much of what you have done in research could impact future services post-COVID-19. One for the afternoon roundtable discussion perhaps, but also one maybe that we can follow up on in the chat. I'm sorry we don't have more time. I want to say a very big thank you to all of you again. It was wonderful. It was informative. Thank you so much for your work. Piotr, over to you.
Thanks very much, Lorraine, for chairing this session so excellently for us. Thank you to all of you presenting. A big round of applause to all the interpreters in Scotland, in Flanders, in Belgium, wherever you are. Your work is hugely appreciated. Thanks very much.